Okay, let's go.
A 32-year-old woman presents with polyuria, polydipsia, and weight loss. Now, the fasting blood glucose is also 180 milligram per deciliter. The glutamic acid antibodies are positive. Now, what is the most likely diagnosis? Now, the most definite answer is A, type 1 diabetes mellitus. But firstly, let's understand some of the key points right here. Now, we see polyuria and polydipsia. So these are the classic signs of a hypercalcemia. So how does this come into being? So when the blood glucose is high, the kidneys cannot reabsorb the glucose. So normally what happens is that the kidneys filters the glucose and the proximal tubules reabsorb it. Now, once the blood glucose exceeds the renal threshold, then the glucose spills into the urine. That's how we experience glycosuria. So now, because glucose is osmotically active, the glucose in the urine pulls the water into the urine. Hence, we are having osmotic diuresis. That is the polyuria. So this causes what? Polyuria, and then the patient loses large amounts of water. Now, this dehydration, it leads to an increased level of thirst. Thus, have a polydipsia. So now this is a triad, very classic for diabetes mellitus. Now let's look at the weight loss. What's happening with the weight loss? Weight loss indicates insulin deficiency. How? It's an important clue because insulin normally helps glucose enter the cells. It promotes fat storage and also promotes protein synthesis. Now, without insulin, cells behave as if they are starving despite high glucose in the blood. Now, the body compensates by fat breakdown, that is lipolysis, and muscle breakdown, proteolysis. So in order to provide fuel, then the result is most definitely weight loss. Now, this strongly suggests an absolute insulin deficiency. Now let's look at the fasting blood glucose also. So we know that the classical expectation is that a fasting blood glucose that exceeds 126 milligram per deciliter confirms diabetes. So if we're having a reading of 180, diabetes mellitus is definitely present. But this does not tell us the type. Now the key differentiator comes next. Let's look at this, the GAD antibodies. So this is the glutamic acid decarboxylase. So it's an enzyme found in the pancreatic beta cells. So what basically happens is that in type 1 diabetes mellitus, the immune system attacks pancreatic beta cells. Autoantibodies, they form against the GAD antibodies. It forms against the islet cells antibodies as well. Now this causes what? An autoimmune destruction of beta cells. There is no insulin production. Therefore, a positive GAD antibodies is equals to an autoimmune diabetes. That is a type 1 diabetes mellitus. So why not the